हेलो एवरीवन, माई सेल्फ रंजन कुमार, आई एम फिजियोथेरेपी स्टूडेंट। सो आज हम स्टार्ट करने वाले हैं विच इज anatomy. The first topic is this bone. What is bone and their function? So bone, it is the one-third connective tissue formation, the main supporting framework of the body. The inorganic calcium salt make it hard or rigid. So what is that? The bone is the one-third of connective tissue of the whole body framework, and it is the supportive part of the body from there provide a framework for it is made up of like a salt, calcium for make it very strong or hard or rigid. So it is a supportive framework of our body, this bone. So what is the function of the bone? So first is support, protection, movement. So ये हमारे बॉडी को प्रोटेक्शन प्रोवाइड करता है, एक स्ट्रक्चर प्रोवाइड करता है जिससे हमारे बॉडी की प्रॉपर फंक्शन मूवमेंट हो सके. इट गिव शेप टू द बॉडी, सपोर्टिंग बॉडी वेट. जो हमारे बॉडी की वेट होती है, जो भी हमारे ऑर्गन, जो भी हमारे सिस्टम्स होते हैं, रेस्पिरेटरी सिस्टम, सर्कुलेटरी सिस्टम, कार्डियोवास्कुलर सिस्टम, जितने भी सिस्टम होते हैं, जिसका जितना भी वेट होता है, उसका जितना भी सिस्टम का वेट होता है, वो सारा ही वेट हमारी बोन कैरी ऑन कर रही होती है और सपोर्ट प्रोवाइड कराती है. प्रोटेक्ट सेंसिटिविटी, प्रोटेक्ट सेंसिटिविटी इट मीन्स जो हमारे सेंसिटिव ऑर्गन्स होते हैं उनको भी प्रोटेक्ट करता है. ब्लड सेल फॉर्मेशन, जो हमारे लॉन्ग बोन्स होते हैं, जो हमारे फ्लैट बोन होते हैं, तो उनमें ही हमारे ब्लड का आरबीसी का फॉर्मेशन वही होता है. Red bone marrow found in the concentric tissue of the certain bone. It is the site of blood cell protection. So हमारे जो red blood bone marrow होते हैं, which is a very essential for our body for carry genetic material or like different things, or like also have making the RBC erythrocytes. So that is the main part of the bone or the body. So bone marrow. So it is concentrated into the bone or protection our red blood cell. Its function as the stronger depot for many of the body needs, example calcium, potassium, sodium. So ये हमारा एक ऐसा पार्ट होता है बॉडी का जो हमारे कैल्शियम, पोटेशियम और सोडियम से मिलकर बना होता है, और जिसके कारण हमारी बॉडी रिजिड, बॉडी के जो बोनी स्ट्रक्चर होते हैं वो रिजिड होते हैं और स्ट्रांग हो जाते हैं. So osteology. So study of bone, it is called osteology. It is a scientific term, osteology. So now the types of bone. So there is a divided into the types of bone on the basis of shape, size, or like that. So we can study further. So on the basis of shape, there is divided into 6 types. So first is long bone. So what is the long bone? So these bone typical have elongated shaft and 2 expanded ends, one or either side of the shaft. It is called diaphysis and or also called epiphysis. Like this is a bone and there is a 2 end, and in between 2 ends there is a shaft. So proximal or distal end where we have a soft shaft, or it is called diaphysis. The shaft is also called diaphysis, or end are also called epiphysis. So there is it is a femur or humerus. So there is a diaphysis, or there is a epiphysis, is a proximal or this is a distal end. So there is example of long bone is just femur and humerus. Next one is short bone. It is a short posture, or can we have any shape. There is no any kind of have a shape. There is irregular shape. So there is a short bone. So what is that? The carpal, tarsal. There is a ear bone, stipage, or that. Flat bone. These are the flat in appearance. So there is example is sternum, scapula, ribs. There is a flat bone. Irregular bone. What is that? So completely irregular in shape, like vertebra, hip bone, and the bones are base of the skull. So there is a different part of the skull like zygomatic major, minor. There is a frontal lobe, occipital lobe. There is a irregular bone make a skull bone. So or also the vertebrae. Pneumatic bones. These bones also be categories under the irregular bone, and also characteristic difference, it is the presence of large air space in the bones which make them lightweight, thus they make from major portion of the skull, or like a sphenoid bone, or like a ethmoid bone, or like maxilla. So जो pneumatic kind of bones होते हैं वो भी एक टाइप की irregular bone होते हैं. उनमें जो मेजर पार्ट होता है, जैसे हमारे एथेनॉइड बोन, लाइक सिफेनॉइड बोन, जो हमारे ब्रेन के जो बोन होते हैं वो इसके अंदर आते हैं. वो होते तो इरेगुलर है, पर लेकिन उनके अंदर एक डिफरेंट काइंड ऑफ कैटेगरी होती है. उनमें एक लार्ज स्पेस होता है एयर का, जिसके वजह से वो न्यूमेटिक बोन कहलाते हैं. सो लास्ट वन इज सिस्मोइड बोन. व्हाट इज दैट? सो दिस बोन इज अ स्मॉल बोन commonly found embedded within a muscle or like tendon near joint surface. So there is a small bone, small in size, and there is a bounded with ligaments or like tendon. So what is the example of sesamoid bone? Which is example is patella. On the basis of development, first is membranous bone. So what is that? So these bones are ossified and membranous or mesenchymal ossification. What is that? So during the like growing of baby into the uterus, so these kind of membranous bone are developed on that time into the fetus, like facial bones, like wallet of skulls, of the skull bones. That like kind of that is a membranous bone. They are developed into the fetus. Cartilaginous bone. What is that? So they ossify cartilaginous. In example, like thoracic cage. So all the like 6-7 rib, they are attached to the cartilage, or also there is, and cartilage is ultimately attached to the sternum. So this cartilage kind of bony framework is known as cartilaginous bone. Next is membranocartilaginous bone. What is that? These ossify partially in membrane and partially in cartilage. Like something is showing the function is to be cartilage, or some function is showing to the membrane. So there is an example is clavicle bone or mandible. On the basis of region, so first is axial bone. These bone forms the axial skeleton of the human body, forms the skull, thoracic cage, or vertebral column. Like this kind of bone is like found in our body, like axial skeleton. Like what is that came in our this skeleton? Like skull, thoracic cage, vertebral column.
Skeletal
all
system.
of us are came in our
Skeletal
axial
system.
skeleton.
Bones and joints form the
Bones
skeletal
are
system of the body.
appendicular
The
skeletons.
functions
Bones
of
of
the skeletal
appendicular
system
skeletons.
are:
What is that? There is a
1.
limb bone.
Support and
Like
protection
these
of soft
bones are
tissues and
formed
vital
to
organs.
appendicular structures
2. To give
and
attachment
connect the
to
parts
muscles.
of the human to axial region,
3. Formation
bone
of red
of limb
blood
and girdle
corpuscles
of
in the
pelvis,
bone marrow.
like pelvis bone,
4.
ilium,
Storage of
ischium,
mineral salts like
like
phosphorus and
femur,
calcium.
tibia, all of the limb bone, like
Classification of
humerus,
bones.
radius,
Bones of the
ulna,
skeleton
all
are
of these
classified
things,
as:
bones are come
1.
into the
Long
appendicular
bones.
structure,
They are found
and
in
this
the limbs.
appendicular
A
structure
long bone contains a
join
shaft
to
and
the
2
axial
extremities.
skeleton and make
The
the
long
whole
bones act as
structure of
levers
the
and help in
skeleton.
various body
So
movements.
that is the basis
2.
of the
Short
region.
bones.
Next one is on the basis of the structure. So microscopic approach. So there is a basis of structure. There is some kind of compact bone, calcaneous bone. So there is also came in our types of bone. So compact bone, also called cortical bone. It is denser, stronger type of bone tissue. It is found under the periosteum and in the diaphysis, where they provide supports and protection, like large bone, shaft, cartilage, cortical region. So in our cortical region, or like a long bone shaft, there is a compact bone. What is that? So there is a in the shaft के पास हमारे डेंस बोन डेंस एक कवर से घिरा हुआ रहता है. उस डेंस कवर को ही हम कॉम्पैक्ट बोन या पेरियोस्टियम टिश्यू से कवर होता है. पेरियोस्टियम जो टिश्यू होता है वो पेरियोस्टियम टिश्यू के अंदर ही पाया जाता है, जिसको हम डायफाइसिस बोलते हैं. डायफाइसिस को मैंने ऑलरेडी बता चुका है. जो लॉन्ग बोन्स होते हैं उसमें प्रेजेंट होता है, जो यहाँ पे हमने देखा था. डायफाइसिस ऑलरेडी हमने देखा था जो शाफ्ट में प्रेजेंट होते हैं, और एपिफाइसिस हमारे एंड पार्ट को बोलते हैं, डिस्टल एंड को बोलते हैं, और डायफाइसिस हमारे शाफ्ट को बोलते हैं. तो लॉन्ग बोन में जो हमारे शाफ्ट होते हैं वो हमारा ही डायफाइसिस होता है, और उसी को हम कॉम्पैक्ट बोन बोलते हैं. सेकंड है कैंसलस बोन. कैंसलस बोन क्या होते हैं? जो स्पॉन्ज काइंड ऑफ बोन होते हैं. सो इट इज अ पार्ट ऑफ बोन वेयर मोर एम्प्टी स्पेस एंड लेस बोन टिश्यू दैट गिव द honeycomb and a spongy appearance. Bone are contracts to combine strength, elasticity, and light has in a weight, like improper part of large bone like ribs and pelvic skull vertebra. So there is a honeycomb kind of bony appearance. So like there is a hole in between the bony compact. So like spongy, like there is a sponge, we have like too much holes over there for the passing the air or like oxygen. So this kind of bone is cancellous bone. So now second is microscopy, microscopy. So fibrous bone, these have more fiber in them, also known as immature bone, found in only the fetus, socket, or alveolar bone structure of skull. So during the development of child into the uterus, all of the bone are came into the microscopic or fibrous bone. There is too much fiber which is immature. अभी वो मेच्योर नहीं हुए हैं, वो अभी यूट्रस के अंदर है. सो अभी डेवलप्ड होने बाकी है. सो जो इमेच्योर स्कल होते हैं बेबी के पेरियोस्टियम में, लाइक यूट्रस में, सो वो उसी को हम फाइब्रस बोन बोलते हैं. Next one is lamellar bone. So most of the mature human bone, whether compact or calcareous, are composed of the plate of the bony tissue called lamina. Example found in the periosteal surface of the diaphysis. So there is a periosteal surface of diaphysis, like it is a long bone, or in the long bone there is, and after the adulthood age, the bone is goes to become like a laminar bone. So it is, the surface is too much hard, or now it will be become like diaphysis to be start to be very much harder, like too much calcium deposit over there, like too much strong. So the bony appearance is too much hard, or like it is also called laminae, or it is like found in the periosteal surface diaphysis over there. Next is bovine bone, occurs in the infertile or in fetal bone in adult women created after fractures. Bovine bone is characterized by irregular arrangement of collagen fiber, large cell number of the reduced mineral contents. So bovine bone are developed on that time if fractures occur. Like if fractures occur and both bone are break down here, so in between two bone there is a like separation. On that separation, there is like generation of new bone. So our bodies like have some system for regeneration power to the bone, if there is some making crack or like healing power, regeneration power. So like woven bone is developed over there. So that kind of bone is called woven bone. So like some collagen fibers are accumulate over there for like regeneration of the bone over there. So cementum or dental bone, what is that? So cementum is the spliced classified substance covering the root of tooth. It is a hardens to act as an adhesive glue. So cementum is that kind of bone which is present in our teeth. So in the teeth, the hardest substance into the root is called cementum. Or like dental is the one of the heart of the teeth, which is like teeth. So root part is a cementum, and then upper part is to the tooth is the dental. So that is the types of bone. So what is the meaning of diaphysis? Tubular shafts between proximal and to the distal line of bone, hollow region inside the medullary cavity filled with the yellow bone marrow or wall are composed of compact bone. So जो लॉन्ग बोन होते हैं उनमें क्या होता है, डायफासिस जो होता है, उन डायफासिस में क्या होता है, मेडुलरी कैविटी फिल होती है जो कि येलो बोन मैरो बोला जाता है. उस येलो बोन मैरो में उसके जो वॉल होते हैं वो उसको कवर करके रखे होते हैं और उसमें उसके अंदर जो हमारा है लाइक रेड बोन मैरो लाइक कवर्ड रहता है, प्रोटेक्टेड रहता है. तो उस प्रोटेक्टेड कवर को डायफासिस कहते हैं. एपिफासिस क्या होता है, wider section of the each bone. It is epiphysis. It filled with the spongy, contained red bone marrow. Like long bone में ही humerus or like we will take humerus or like femur. So in their epiphysis, so in the in part there is a covering of harder surface and protecting of the red bone marrow. तो वो protect करके रखते हैं red bone marrow को. और जो area रहता है epiphysis का उस वाले एरिया को ग्रोथ प्लेट बोलते हैं. बिटवीन 18 to 28 बोन गेट ऑसिफाई इन द एपिफाइसियल प्लेट. जो हमारे 18 से 28 बोन होते हैं उस एरिया में ग्रो कर रहे होते हैं. जो एपिफाइसियल प्लेट होता है वो हाईली कार्टिलेजिनस होता है और एपिफाइसियल लाइन जो होती है उसको ऑसिफाइज लाइन बोला जाता है. सो हमारा जो पेरियोस्टियम जो होता है, पेरियोस्टियम जब बेबी यूट्रस में रहता है उस समय जो हमारा ग्रोथ हो रहा होता है उसको ऑसिफिकेशन लाइन बोलते हैं. और उसी समय हमारी जो हमारी बोन होती है ब्लड मैरो, ब्लड को जनरेट कर रही है, ब्लड मैरो को प्रोटेक्ट कर रही है और उसी को एपिफाइसिस बोलते हैं. So what is medullary cavity? It is a membranous lining endostem where the bone repair, growth and remodeling. So medullary cavity is what? So it is a place where like all of the bone have to be like growth and repair or remodeling. So whether it will be long bone, whether it will be irregular bone, short bone, flat bone, so sigmoid bone, all of the things they will be determined in the medullary cavity. So which kind of bone will be that can be occur or like repaired in the future, it depends on the medullary cavity. So their growth or remodeling after the fracture, there will be regeneration power. All of the things are handled with the medullary cavity. So that is all about of the bone. Thank you.